What are the 6 main risk factors for cardiovascular disease? With heart disease being the #1 killer for both females and males in the United States, you may have been asking yourself if you're at risk. If that sounds like you, then you are in the right place. I'll be sharing all the details and answering that question in today's video. Let's get started. Hi, I'm Dr. Kelly Shockley, Doctor of Cause, Chiropractic, board certified in sports medicine, and specialized in clinical nutrition. In this video, we're going to cover the 6 main risk factors for cardiovascular disease. There's more to it than just your genetics. Then we'll cover the #1 biggest lie you've been told your entire life and no longer have to believe. This is a total game changer. And finally, I will be sharing the most common mistake you're unknowingly making when it comes to avoiding heart disease. Make this shift and you will be unstoppable. Let's dive in. Okay, so what are the 6 main risk factors for cardiovascular disease? I'm just going to list them out and then we're going to go from there. Okay, so there's inflammation, physical inactivity, obesity, type 2 diabetes, high blood pressure, and smoking. There are other factors that could put you at risk, but those 6 are the absolute core risk factors associated with heart disease, partly because they all stress your heart out for various different reasons. You'll see that there's crossover between them. Inflammation is linked with diabetes as well. Physical inactivity is linked with inflammation and diabetes too. Obesity goes hand in hand most of the time, but not always, with type 2 diabetes. And then smoking kind of just puts everything into fast forward motion. It's like aging in fast forward. Inflammation is the root cause of all disease and illness, so it's no wonder we find it here on this list of risk factors associated with heart disease. You see, none of those are necessarily related to your genetics. I know that there is importance in knowing what your family health history looks like, and people who have aunts and uncles and parents and grandparents that have had heart disease or have had heart attacks, especially if they had a heart attack and died before the age of 50, generally need to be more aware of their current level of health and what their risk may be. Those people also should be doing that much more to take care of themselves. You see, something interesting about genetics is not that there's necessarily a gene for heart disease, but let's say that there was, okay? Just because you have a gene for a particular disease or even like a cancer doesn't mean you're going to end up with it. Okay? Your family's history doesn't have to be your future story. And when it comes to genetics, what we've learned is there's something called epigenetic expression, which ultimately, think of it this way. Think of a gene as being like a light switch. It's either turned on or it's turned off. As long as the gene is turned off, it can't express what it's coded for. If it's coded for heart disease, let's say, you can't end up with heart disease unless it's turned on. So as long as it's turned off, that doesn't become a thing if it's purely related to a genetic issue. But then on the opposite side of that, if it gets turned on, then what that gene is coded for can be expressed, which then shows up as a heart disease if there was a particular gene associated with that. So the biggest thing to know is, how do we turn genes on and off? It's through our lifestyle and how we're living each day. Just as much as it is for us to avoid becoming overinflamed and not obese and not ending up with type 2 diabetes and choosing not to actually add smoking into our life, whether it's vaping or not, all of that's bad, okay? It's just as much important for the same reason, but a little bit different undertone of that's what you do for making sure if there's some sort of a genetic history and a link that could be associated with heart disease in your family, that when you have the healthy lifestyle factors, which ultimately keep you out of the main risk factors for cardiovascular disease, you also keep genes in their off position so that whatever they're coded for does not end up being expressed. Little complicated, but ultimately you're in control of that. Okay, as long as you're making sure you're sleeping and you're eating right, you're getting exercise, you're doing some stress management techniques, you're avoiding bad social habits that are not good for us whatsoever, even if they're calming or relaxing for the time being. You're, living a life of gratitude. There's so many things we have the ability and control over. So you don't have to be fearful. Just know these are the factors that are most commonly associated with cardiovascular disease. And you have control over if that becomes part of your reality or not. Now, I'm curious, did you know that those risk factors actually carry more weight than just your genetics alone? Let me know down in the comments below. I'm anxious to hear what your thoughts are. What's the biggest lie you've been told your entire life and no longer have to believe? It's something that if you've gone into the doctor at all and just as a general health scan, or they know that you have a family health history of heart disease, they probably ran this test on you. It's cholesterol. Here's the thing. What we've been taught about cholesterol is actually kind of wrong. Okay. And by kind of, I mean it's completely wrong. Here's a fun fact for you as it relates to heart disease and cholesterol. 50% of people who have heart attacks have normal levels of cholesterol. Yet, that's the gold standard initially for medical to evaluate, are you at risk for a cardiovascular event, whether it's a heart attack or a stroke or what have you, or not? Here's what you need to know about cholesterol. It's not the bad guy. Your body has to have it. It's in every single cell in your body. So you can't get rid of cholesterol and expect to be healthy. In fact, you'll have even more health problems with not enough cholesterol than if your cholesterol is a little bit elevated. It is a really crummy predictor for evaluating your risk. There are other markers that you can have evaluated, like your inflammatory markers. They're a better predictor of if you're at risk of a cardiovascular event or not. Or something that I run on my patients is called the BNP, B-natriuretic peptide. This is a protein that your heart will release into the body when it's being stressed. It is the most sensitive predictor for any kind of cardiovascular related event long before it ever actually happens. Because guess what? The most common first indicator of heart disease is a heart attack. And one happens every 40 seconds here in the United States. I don't know about you, but I don't want to wait until a heart attack actually happens to know what the level of my health is for my heart and the rest of my cardiovascular system. So this BNP detects that before a heart attack would ever even happen, or a stroke or what have you. Life insurance companies used to require this marker be ran on their applicants before they would actually insure them. But what happened was insurance rates went way up, and so they quit requiring it. In fact, insurance companies are charging anywhere from like $450 to $500 for the one marker. But it's so important. So I want to share with you a little bit of story. This is my patient, Mike. He came to me, this was last year, complaining about gut problems. And he's a thin guy, and that was frustrating to him. No matter what he was trying to do, he couldn't gain weight, and his guts were just kind of upset. He has some acid reflux, but also have some lower GI types of problems as well. So that is what he came to me. And because he's very much in a preventative mindset, and there's different health issues that run in his family, we opted to do a more extensive initial set of tests on him, and we included in this BNP. Well, I got his results back in, and I had to give him a phone call. I looked at his results, and he was a ticking time bomb. His BNP was way sky high. Like literally his heart was saying it was extremely stressed. And then I look at his inflammation markers. Those were actually okay. There's another marker that I look at that tells me about muscle breakdown. It was also really sky high. And then his cholesterol markers were not that bad. Okay. But this other marker was sky high. So I called him and I asked him like, hey, Mike, how's it going? How you doing? Oh, I'm fine. I'm having a great day. Like, how do you feel? I was like, I feel great. Fantastic. However, I just got your results back in. I need you to go into the ER and get an EKG done because right now your heart shows that it's really stressed. And I know you feel fine, but we just want to make sure that it is behaving the way that it should be. So I'll send you your labs, raw data. You can take it into the ER. Tell him you'd like to have an EKG done. So he gets to the ER and I get a text from his wife and she's like, they don't want to do anything. They don't want to give him an EKG. They don't understand why any of these tests were even ran. They don't even think that this is the right place for him to be. He should be seeing an internal medicine doctor. And I'm like, oh my gosh, okay. Well, it hit me like a ton of bricks. The reason why they didn't know what to do with him is because he didn't walk in complaining of chest pain and like tingling down the arm or into the face, like all your classic heart attack types of symptoms that people normally come in with. He didn't have. He had no symptoms. He felt fine. But he had lab work that said otherwise. And so they didn't know what to do with him because everything they do is a response to how you present and what your symptoms are. I told her, I'm like, make sure you do not leave before you get an EKG. Like, you can have this, like, basically you can demand it be done. And ultimately, the ER doc was like, all right, whatever, I don't think we're going to find anything. And I think this is kind of crazy. And again, I think you should be at the internal medicine doctor, which I'm not sure why he said that, because BNP doesn't have to do with internal medicine per se. I mean, it's heart related. So if anything, he should have seen a cardiologist, not an internal medicine doctor. However, long story short, get his EKG back. And thankfully, everything was still showing that it was fine. So what that meant was he was not absolutely in a crisis. He was going towards a crisis, okay, because of how his markers showed. Things will show up in the blood long before they show up in a biopsy or a scan or other tests that we can actually run on people to evaluate health. So what that meant was we had time, but I needed him to get his act together. We cleaned up his diet. We gave him nutrients based off of what his results showed. And he started implementing some stress management techniques because life had been extremely stressful. He's a business owner. Him and his wife have a home care business, which is more stressful than what they ever even knew it would be. It's rewarding because they're helping people, but caregivers are kind of a nightmare just employees in general can be a bit of a nightmare. And it had been very, very stressful. Fast forward to 2 weeks later. We reran those few markers again that were really sky high. And everything was back into an ideal healthy range, which is not the clinical range, but everything had improved dramatically. And this was phenomenal. I had not seen a BNP respond to that implementation of, lifestyle and diet and nutrients. I hadn't seen one drop that fast. So my colleague, my mentor, I shared this information with him and he said, Kel, you just saved him from having a heart attack. I mean, we don't have proof, but at the same point we do, because it will show up in the blood before it shows up on an EKG. And he was mind blown. Okay. BNP is far more predictive than cholesterol. Oh, and by the way, his gut stuff is like gone and he doesn't have reflux and overall he feels healthy and he's gaining weight, which he's incredibly excited. The key here is cholesterol is not the bad guy. Something to know about cholesterol is you can't look at it on its own. Oftentimes, your doctor will run what they call a lipid panel. That will have your total cholesterol, your LDL, which is your bad cholesterol, your HDL, which is your good cholesterol, and your triglycerides. Maybe they run a VLDL, which is more like sludge-like cholesterol. It's important to look at how those all come back. If total cholesterol and the LDL cholesterol are elevated, but your triglycerides are in a perfect range, there's probably not a whole lot of diet influence as to why your cholesterol level is high, contrary to what people may believe or have been told. If the triglycerides are high, then I also encourage you to look at the diabetic markers like blood glucose and hemoglobin A1C. If those are high, then absolutely there is more than likely some influence from what you're consuming diet-wise that's elevating your cholesterol. But let's go back to when triglycerides and diabetic factors are all perfect. Total cholesterol, bad cholesterol, elevated. What does that mean? In traditional medicine, they put you on a cholesterol-lowering medication. In functional medicine, there's other docs that'll put you on, cholesterol-lowering types of nutrients. It's essentially doing the same thing. Elevated cholesterol is a symptom of something. Okay, we don't want to just take care of the symptom. We want to figure out why it's elevated in the first place. And what I've come to know is that total cholesterol, LDL cholesterol can be elevated as a protective mechanism by your body. So think of this. If your body's trying to protect you from something and you take a cholesterol-lowering medication or you're doing a ton of omega-3 fatty acids because both will lower cholesterol, you're getting rid of your body's protective mechanism, but you haven't answered the question, why is it being protected in the first place? What I've found out is oftentimes I will see this pattern in people who have a low level, undetectable unless you're doing testing, infection, like chronic level of infection, underlying inflammation. Also, I've seen this with people who have major toxicity issues, and then other different nutrient imbalances and deficiencies. Once you clear those things up, the cholesterol level goes back into its normal ranges without you having to actually focus on it, because now you took care of why the body was protecting itself. The long and the short of it is, Cholesterol is not the best predictor of your level of cardiovascular risk or your health, and you need to have it. It should not be kept to very, very low levels. It is not why we have heart attacks. Inflammation is more of the reason, and there's other factors in there too. Now, before I get into the most common mistake you're unknowingly making, I want to remind you to subscribe to my channel and turn those notifications on. Just click that subscribe button down below, turn the notifications on. I am producing videos for you on a regular basis, everything to do with heart health, brain health, gut health, immune health, you name it. It's all health related, and it's geared to help you take back control of your health so that you can achieve something I like to call total body mastery. So just click the subscribe button, turn the notifications on, and you will be set. Awesome. What is the most common mistake you're unknowingly making? It's judging the level of your health by how you feel. Let me say it this way. How you feel is not the best indicator of how healthy you are. And I kind of alluded to this already. The number one sign that shows up that you have a brewing heart disease happening is a heart attack. And oftentimes these heart attacks can be fatal. Every 40 seconds, somebody is having a heart attack in America. I don't believe that's the best approach if we want to try to avoid cardiovascular disease. So where does that leave us? Like, what is a better way to evaluate? One, we can implement what we know needs to happen in order for us to be healthy. So we're talking about all the lifestyle factors, not eating out all of the time or living off of fast food, not eating processed and high levels of sugar containing foods, like eating food the way that God intended it, natural occurring foods, okay? Stress management, making sure we're sleeping, like quality levels of sleep at night, getting exercise. All the things we already know to be healthy are going to help reduce risk of cardiovascular disease because they all affect the risk factors that are associated with cardiovascular disease as well. But there's another way we can go about this, and it's like what I was doing with my patient Mike. Proper testing. If you're not testing, you're guessing, but it has to be done the right way. You can't just test things that are associated with the heart and have a true appreciation for what's going on in the rest of the body. If you only run markers associated with the heart, which most, docs, the things they run first are those cholesterol, the lipid panels. If you see, again, as I was mentioning, the total and the LDL cholesterol are high, but everything else looks fine. If you don't look at the rest of the body, you're not going to know why your body's in a protective state. Okay, so you have to look at the whole entire person all at once. Now, this is easy to accomplish. It's not necessarily something that gets to happen at your MD, though you can try. Getting an annual exam, it depends on what all they're running. Back in the day, doctors used to run more like 40 markers just on an annual exam basis, not needing any kind of explanation as to why. That list has gone down. It's only about 20. Just for a comparison stance, when I run a very base level of testing, I'm running over 100 markers because I want to evaluate every organ system in the body. I want to see how is the body doing with toxins? What does the inflammation look like? And other factors so that we can really have a clear picture of what your current level of health is. Once we understand the clear picture of what your current level of health is and how it's all connected, we can then create a concise plan to move you forward to reclaim your health again. Now, I know you're probably sitting there going like, Kelly, how in the world does this work and how do I make this happen? Don't fret another moment about that because I have something for you. Down in the description, if you click on that so it expands, there is a link to a free 5-day health challenge. Okay. This is where I lay all of this out and I show you exactly how to have this done for yourself right from the comfort of your very own home. And by the end of the 5 days, you will know exactly how to determine where your current level of health is at. If you're dealing with diabetes or you're dealing with being overweight or inflammation, whatever the case may be, you'll have now an understanding of how to determine why. Once you understand the why, you can create the plan to move you forward that's customized specifically to you. So if that sounds awesome, then click the link down below and I look forward to seeing you on the inside of that health challenge. Thanks so much for being here. I hope that this helped shed some light for you and gave you more insight as to what you need to look into to help protect yourself from cardiovascular disease. I look forward to seeing you on a future episode. God bless.